Hello, everyone. I'm Brandon Hawker with the Open Minds Market Intelligence team. And I'd like to welcome all of you to today's Circle Elite Executive Roundtable, Centers of Excellence in Addiction Treatment, the Hazelden Betty Ford Foundation Case Study. Today's roundtable features Kim Albers, the Director of Recovery Management at Hazelden Betty Ford, and Jennifer Duncan Sanford, the National and Strategic Account Director at Hazelden Betty Ford. Kim Albers has an MA in Addiction Studies and is the Director of Recovery Management at Hazelden Betty Ford. Here, she supports programs to provide ongoing recovery support following clinical care. And prior to this role, she worked for 10 years in residential treatment at the Center City campus as both a direct care clinician and a program manager. During her role as a program manager, she oversaw the delivery of care as a part of the integrated treatment team that serves patients in residential care for substance use disorder, as well as co-occurring mental health and trauma-related needs. In addition, she led the care of both healthcare professionals and legal professionals seeking treatment services. She has worked in multiple positions over her 18-year career to include providing crisis support in a call center, supporting patients through early engagement and care as a case manager, as well as providing substance use treatment with a correctional facility. Her areas of interest include reducing stigma, expanding access to care, and recovering resources and utilizing innovations to improve treatment and outcomes. Ms. Albers holds a master's degree in addiction studies from the Hazelden Betty Ford Graduate School of Addiction Studies and a bachelor's degree in psychology from Southwestern University in Georgetown, Texas. Jennifer Duncan Sanford has over 25 years of experience in direct clinical care, clinical management, and account management in both the public and private sectors. Ms. Duncan Sanford received her master's degree from Florida State University and is licensed as a clinical social worker in both Illinois and California. As a National and Strategic Account Director, Ms. Duncan Sanford is the trusted advisor and primary point of contact for national insurers and EAPs. She builds long-term relationships with customers and is responsible for keeping current clients satisfied and delivering exceptional client service on a day-to-day basis. Ms. Duncan Sanford ensures the timely and successful delivery of Hazelden Betty Ford's solutions according to customer needs and objectives and communicates the progress of monthly, quarterly initiatives to internal and external stakeholders. I will be moderating today's roundtable. Before we get started, a few housekeeping reminders. As always, your audio will be muted during today's briefing. However, we encourage you to submit any and all questions you may have using the question box located on the right of your screen. We will present audience questions at the end. Finally, the slides and recording from today's briefing will be available on the Open Minds website by tomorrow. Let's dive right in. Would you mind going to the next slide, Jennifer? So today's learning objectives will be how traditional payment models do not address longitudinal issues adequately, how quality, efficacy, and the use of evidence-based practices vary greatly, and how employers can steer their employees to the most effective care. Finally, we'll follow up with the results of higher care management engagement with the support for the individuals and the family, as well as other key participants. Next slide, please. So substance use disorder in America. Just a little bit of background. As of June 2020, 13% of Americans reported starting or increasing substance use as a way of coping with the stress or emotions related to the COVID-19 pandemic. I'm sure this is nothing I need to say, but the pandemic has caused high intense stress, not only for workers, family members, people who aren't even in the workforce. They cope with that in various ways, and a lot of them do turn to substance use disorder or substance abuse. Half of all US adults, 46%, have dealt with substance use disorder in their family or know someone who's dealt with that. Next slide, please. Finally, substance abuse in the workforce is a growing problem. The Surgeon General estimates the society as a whole loses $442 billion annually due to addiction. This is from absenteeism, lost productivity, and finally, healthcare expenditures related to substance abuse. Prior to COVID-19, 11 million full-time workers in the United States were actively struggling with substance use disorder, and this number has only grown since the pandemic. Okay, Jennifer, I'll turn it over to you.
Well, thank you. And first, I just want to say thank you very much for allowing us to present. It's an honor to be able to present for Open Minds. So thank you for having us today. A little bit about Hazelden Betty Ford, just so you know who we are. We have been a substance use treatment program for over 70 years, but we are not just a substance use treatment program. We also have research, publishing, education, and recovery advocacy. So we are a nationwide substance use treatment offerings, and we have both in-person and virtual services throughout the nation. So I just wanted to show just a map of who we are and where we are, so you know where our foundation begins. So why are we here? So looking at escalating epidemics of opioid addiction, alcohol addiction, stimulant addiction, the addiction has not gotten any better over the last few years. And honestly, I looked at an article from the Washington Post even just yesterday, looking at the fentanyl crisis that is happening and how that has escalated since even the pandemic. So fentanyl overdoses and overdose deaths in San Diego County, which is where I am, has quadrupled from 2019 to 2021. And the supervisors of San Diego County have now developed a fentanyl crisis support group that they are really working to be able to get education and early intervention out there. So not to looking at, well, okay, that's San Diego County. Well, also in that article, the Washington Post described how the disease control and prevention showed that fentanyl deaths are now the #1 killer for people who are 18 to 45 years old. And that's surpassing deaths from car accidents, gun violence, heart disease, and COVID. And according to the Department of Health and Human Services, more than 9 million Americans have misused opiates in 2020. And the fatal overdose deaths from 2019 to 2021 surged 94%. So today, 196 Americans are now dying each day from fentanyl overdose. And that is like a fully loaded Boeing 757 crashing every day and killing everyone on board. So looking at that crisis, which is just terrifying, alcohol still kills more people than drug overdoses. And according to the National Institute on Alcohol Abuse and Alcoholism, 1 in 4 Americans increased alcohol use during 2020, and the general consumption of alcohol use increased 39% from February of 2020 to November of 2020. So the problem is not going away. And with that, we want to look at treatment options. So the quality and the efficacy of treatment options varies greatly. I'm sure all of you have seen the different FBI raids that have gone throughout the entire country of folks that are taking advantage of folks who have a substance use disorder. And then historically, for even those treatment centers that are ethical, a lot of the treatment has been focused on episodes of care, and the way reimbursement is through that episode of care versus the chronic illness that individuals actually experience. And then looking at employers, so looking at being able to how can employers help their employees the most? So again, looking at addiction in the workplace. So we talked about the problem. Now we'll want to look at, all right, so who are those folks? Who are the folks that are addicted? So most people who abuse alcohol or illicit drugs are employed. So looking at 76% of the illicit drug users are employed either full-time or part-time. Nearly 43 million adult binge drinkers, 81% are employed full-time or part-time. And 12.4 million heavy drinkers, 80% are employed. So again, this is not something that is the person under the bridge. This is your neighbor, your boss, your coworker. So again, the problem. Substance use disorders impacts almost half of employed folks. We're talking about in any way, whether it be that person having a substance use issue or their family. So 46%, which I believe Open Minds also said in the beginning, have dealt with substance use disorder in their family in some way. And it's not just people, it's also business. So looking at the cost of addiction is over 400 billion between absenteeism, loss of productivity, and the healthcare costs. So that's something that also gets the attention of the executives on the call. Over $400 billion. So like I said, who do you think have, are the folks that have an addiction? Like most people think, oh, it's that person under the bridge, the person living under the freeway. Those are the folks with addictions. But these are the folks that actually have an addiction. These are the folks that need the help, that have the struggles that are right next to you. So we're looking at your doctor, we're looking at your coworker, your boss, the person who's driving your kids or your grandkids to school. These are the folks that have an addiction. It's not just those that are under the bridge. And it's these folks, looking at your siblings, your children, your parents, your coworkers, the friends that you go out with, every Friday. Like these are the folks that are struggling and have a stigma that they need to overcome in order to be able to get help. And bad decisions are not new. This is one of those famous pictures from the construction of the Empire State Building in New York, and just makes me dizzy just looking at it. And if you look at this guy right here, he is holding a bottle of alcohol. Can you imagine? I mean, all these folks just sitting on this steel, really having him be on the edge. And then he could fall off, but he could also impact all of his coworkers. And this is before OSHA, before all of that. So just looking at these, this is not new. This is something that we want to make sure that we address and bring to the surface. As I said, addiction affects everyone. Doesn't matter race, ethnicity, age, education, profession, wealth, geographic location, religion, political affiliation, it doesn't matter. It affects everybody. So with that, I want to tell just a short story about someone who I know well and work with currently. This is a person who works in Chicago, lives in Chicago, and this is the before. This is when he is a high-level executive at a Fortune 100 company, being very successful, doing very well, very smart, and celebrating with his executives, going out on networking events, bonding, very high energy, fast-paced finance industry. So with that, he's having fun. He's going out, doing the Thursday night, the Friday night, which then turns into the Saturday and turns into the Sunday, and then needing something Monday morning, and becomes addicted. Here's what that looked like. So this is during the addiction. Again, someone who is very bright, very successful, and very good at being able to hide what was going on at home and be successful at work for a period of time until he couldn't anymore. And what happened at his work is that his bosses had 50 meetings about him, but they had one meeting with him. And that meeting was the meeting in which they fired him. And now he was a high-level executive. So when they let him go, he gets a severance. He gets, a package to go home with. And what happens then? He gets worse. Just absolute psychosis. Completely falls apart and is not able to function. So he was able to then get into treatment. And today, this is that same apartment. He's a happy family, very happy dog, and doing very well. So with that, looking at navigating the system, how does someone get into treatment? Well, substance use disorders are diseases that are just filled with denial. And then once somebody decides to search for help, it is so difficult to navigate the system. And some of what I was talking about earlier about what's a good treatment center? Where are the good ones? How do you know that it's not one that's going to be invaded by the FBI the next day? How do you know that they use evidence-based treatment? And it's even more difficult to find that ethical provider who's in network. And then if you have a diverse community, the difficulty is even more magnified. And the new healthcare consumer. Open Minds had an article not too long ago in August of this year looking at what are the keys to success with this new healthcare consumer. Well, they want timely access to information, looking at a positive brand impression through that user's experience, and convenient and confidential initial engagement. So looking at brand trust and looking at what does that mean? And how are Americans trusting corporations versus even their government? And looking at finding that ethical provider. And what we feel like we are at Hazelden Betty Ford is a trusted entity that enhances the value and validity of an existing brand. So folks are more likely to have confidence and brand trust in their work, in their business compared to the government. And then with that, adding Hazelden Betty Ford to that company trust, whether it be in a center of excellence or a joint or co-developed content, this can evaluate this trust even higher. So brand trust is very important, and that user experience is everything. So in a summary of why we would want a center of excellence for substance use disorders, we're looking at that escalating need, and that the workers that are returning to work are not the same workers that left prior to COVID. Opiates are just out of control between what's the fentanyl epidemic and what's happened through COVID. And the traditional payment models just don't address this longitudinal issues adequately. The quality of organizations varies greatly. So how do you help somebody find a location to go to and that it is in network, because the out of network costs are just astronomical. So looking at the best of the best providers, maximizing evidence-based practices, utilizing higher care management, and addressing that longitudinal nature of the substance use disorder. So looking at that whole person. So we're talking about not just the benefit through somebody's insurance. So someone goes through residential and then maybe partial or intensive outpatient. And then what happens next? So with that, I'm going to pass the baton to Kim, and we will talk through some of the centers of excellence and how we are able to add to that benefit that a provider is able to provide that service. So Kim, there you are.
All right, thanks, Jennifer. And so I'm going to spend the next several slides talking about a program that we've developed for our Center of Excellence partners to address substance use long-term. as you've just heard Jennifer talk, this is a illness that is chronic in nature and really needs longitudinal support. Connection is the name of a Hazelden Betty Ford program that we developed in 2011. And the primary goal was to improve recovery outcomes for people through intensive recovery coaching, monitoring, and accountability over a longer period of time for both the individual with substance use disorder, but also families. And Connection, if you think about programs that are designed for health professionals, pilots, it is modeled after a program like those, where it has long-term support with key factors that I'm going to talk about. The primary task of the Connection program and the support work that our recovery coaches do with individuals, they're focused on key recovery areas that we already know about that are milestones of a person's early recovery. And first and foremost, the task is our recovery coaches to work with an individual as they enter into the Connection program around the real world issues, which are typically transitioning from clinical services out back home. And so the program we've developed combines residential acute treatment as a residential stay, followed by 12 months of the Connection program, which is that recovery support. So the real world factors that the recovery coach is working on is, again, transitioning home, navigating back to work, navigating back into the family, ensuring they're connected to the recovery support in their home area, and starting to connect with any professional continuing care. As they progress in this 12-month recovery support program, the goals start to shift and they start to focus on developing a balanced life. So addressing the whole person, as Jennifer mentioned before, starting to build those healthy social recovery contacts, doing emotional, spiritual work without substances, and then regain or gain for the first time financial and vocational stability. It's during this time too that we know that there are going to be some challenges in early recovery. We can predict those, and the Connection recovery coach can help that individual through those. However, there's also unexpected life challenges that are going to come forward, and so the recovery coach will be with them through that as well. And then after 12, or as the person is progressing in that 12-month period, ultimately our hope is that the recovery coach can, in partnership with that individual, help the member set personal recovery goals, meaningful life goals for their lifetime of recovery, which are, typically at the stage where someone has progressed and completing the program. So let's go to the next slide, Jennifer. So I want to talk a little bit about the specifics of who the Connection program is helpful for. And what I would say is really, it's hard to imagine someone that it wouldn't be of benefit to in early recovery. Everyone can benefit from this because, again, the illness is chronic and recovery is not one event. However, there are certain individuals that it really is tailored to. And folks who have been through multiple treatments, who have struggled to maintain continuous abstinence, individuals who may be facing a risk of losing their professional license, struggling with legal issues. A lot of times when folks are in the middle of substance use, some of those hard factors are the family is significantly impacted. There may be custody issues where verification of someone's sobriety and abstinence is going to make a key difference in them being able to see their kids and reclaim their parenting role in the lives of their children. Other groups of folks that benefit from Connection are students who maybe they've been to school or going to school for the first time, and that added benefit of accountability and having a neutral person and a recovery coach be able to provide that recovery support while they're at college helps free those parents to be able to support them as a student, as we normally do as parents, without taking away some of that fear that they would feel when their child goes back to school. And so really anyone that needs additional accountability would benefit from our connection program. And when I think about what Jennifer just talked about around how people enter recovery, or excuse me, enter treatment, one of the I think values for the member and family are when we have a partnership with the Center of Excellence, that member will come to treatment and they'll know that they're going to have a residential stay followed by 12 months of long-term recovery support. So that stress of what's next after their treatment stay is no longer there. And this recovery program can travel with them back home. So it takes away a lot of the stress that is unnecessary for people. As members enroll in the connection program, the first thing we're going to do is meet with that individual and have them identify key family members or loved ones that they want involved, and also other key stakeholders. And key stakeholders are folks who are invested in that person's recovery. They're invested in the person getting and staying well. And some examples here are an employer, a school administrator, probation officer, but we're not limited to just these on this slide. It really can be anyone that the member identifies and wants to be involved. And the program is really tailored at that initial enrollment with the member. Again, who's going to be included and what that's going to look like for the 12 months. All right, Jennifer, if we go to the next slide. So the details of the connection program, these are the components. It involves one-on-one coaching and support with a professional recovery coach. The cadence of this is really matching the early recovery milestones that we can predict. We know that someone leaving clinical services are going to need more support in that initial transition back home. So weekly calls are typical for about the first 3 months, then transitioning to bi-weekly calls for about 6 months, and then wrapping up with monthly calls if the person's progressing in their recovery. The other key factor of the connection program is not only do the recovery coaches provide that one-to-one support for the member, but they're also providing that same cadence and frequency of support and coaching for the family members and stakeholders. This is a unique factor of the connection program. We're still focused on the individual with substance use moving into recovery, but our recovery coaches are also skillful at helping those family members and loved ones focus on their own recovery, what are their needs, and link them to resources that are within our continuum or outside our continuum. Another component of the coach's relationship during this 12 months is they're monitoring to ensure the individual is following continuing care recommendations. This might be follow up with their primary health provider, individual therapy, whatever's recommended. They want to make sure that they're following through with that. And if they're struggling, help troubleshoot and problem solve to get them back on track. There's monthly accountability verification that all of the stakeholders receive. And then another key component of the coaching is to couple that with random substance use screens. And the cadence of these random substance use screens tend to follow the cadence of the calls. Again, more screening in those initial months when recovery is such a vulnerable time. But however, that is a tool that can be used as needed as that person moves through that 12-month period. And we have a variety of ways to screen for substances. And again, that's individualized based on the person's needs. And as we've laid out over these 11 plus years of having the connection program in existence, we know the trajectory. However, lives don't always follow those plans. And so we know someone who might be progressing in their recovery and and following all their continuing care, there may be unexpected challenges that come up. Someone may struggle, and that's where the recovery coach can really come in and help intervene and support that individual when they're struggling and help get them back on track. And this is really the beauty of the Connection program and having that longer term recovery support is without that, they would be out there struggling on their own potentially. Because they have a relationship with a professional recovery coach, they have the people that care about them also involved. And we have ways to also see signs of struggle. An intervention can happen early on and really help support that person. So if it's a struggle, it isn't a complete slide into return to use that they are not able to, they're not able to pull out of, and may really get to a place that is more difficult than it needs to be. So we can respond to those individual needs. And then lastly, when a person is coming to the close of their Connection program, that enrollment period, the recovery coach provides a completion letter to all involved. And if we go to the next slide, I want to talk about one of the components I mentioned, but delve a little bit deeper into it, because this is, I think, a real value for our Center of Excellence partners, the monthly Connection reports. And these are monthly reports that we send out to all identified stakeholders about the progress of the individual enrolled. And it will give the basics of their, the status of their sobriety or abstinence, scheduled and completed contacts, results of any substance use testing. Are they participating in recovery supports in their community? 12-step participation, mutual aid supports. If medications are a part of their recovery plan, we'll provide some reporting on monitoring of that, compliance of care plans, housing status, and then we do an overall summary of any stakeholder communication in that report as well, to see how people are involved and what that input is, and overall progress in recovery, and ongoing recommendation goals for the next month. Again, these are really nice to have, and I think not only do they provide verification for those invested stakeholders, for family members, it again reduces some of that stress knowing that there's someone skilled and trained supporting their loved one in recovery, and it doesn't have to be them, because usually the family member's role prior to coming into treatment is often one of desperation and always monitoring themselves, the individual's health and well-being, and this removes some of that. So a really important tool. If we go to the next slide, this just shows some numbers from the Connection program. And if we look back at 2021, we served 237 participants in the Connection program, and that's individual members with identified substance use. It doesn't include the family members or stakeholders. At a 92% of those enrollees successfully completed the program, meaning they completed the enrollment period. They were active in participating in the scheduled calls. They followed discharge plans, and they were also able to demonstrate some key recovery capital measures, which are increased social support, decreased symptoms. They've built their network, and they're starting to feel prepared for managing recovery on their own through that longer term engagement of the Connection program. When we do satisfaction surveys for those who participate, 96 of the participants rate their experience very good or excellent, and 99% of folks would recommend it to someone else, which I think says a lot. They benefit from it and see the value. And then when we look at over a period of 5 years, when we've looked at outcomes, what we know is that 86% of the participants at time of the call report abstinence, and 60% of participants report continuous abstinence through all reporting periods. And this is important because continuous abstinence is not the only sign of success. What we know is that, again, people people's path towards recovery and long-term sobriety sometimes involves brief terms returns to use and struggle, and it's having that safety net and recovery support that can really make the difference in achieving long-term sobriety. And before I wrap up, what I want to say is what these numbers don't tell is almost the weekly stories of healing and hope that we hear from individuals and their family members as they're approaching the wrapping up the connection program. It's through the program that they are able to reclaim their lives and they have hope for their future. And I pass it back to you, Jennifer.
Thank you, thank you. I really appreciate your description of the program, and it is one of those that it is the differentiator. And with that, we work a lot with payers in regards to the Center of Excellence. So payers, employers, EAP, and we only have so much of a line of sight into some of the results because we don't know if somebody readmits into another program. So we don't have that data. But what we are able to do is then partner with our payers, and they're able to give us some data on some HEDIS measures. So 7-day follow-up, 30-day follow-up, readmission, 30, 60, 90 days. And they give us data back on how we are doing and how their members are doing. So this is just an example of that. And then I have another example here of another payer who looked at not just some of those HEDIS measures, but also really looking at outcomes, comparing centers of excellence with out-of-network results, centers of excellence with other in-network providers that are not center of excellence. So what you can see is the out-of-network facilities cost significantly more, 240% more, and their readmission rates are 71% higher. But I think what's even more interesting is looking at the other in-network facilities. Their cost is still almost 20% more, and they have a 22% higher readmission rate. So this Center of Excellence program, it shows that the outcomes are not just with financial, they're also with members, looking at their readmission rates and really making sure that people are taken care of. So with that, I know you all can read, and at the same time, we received a letter from a member in February of this year describing her appreciation for our Center of Excellence program. And so I do want to read this. And for anyone who happens to be multitasking and is not looking at the slides, I'm hoping that this will help. This letter made everybody at our organization cry. So we had to share it. So I will start there. I have been a functioning alcoholic since I was drinking during the day at high school, with the exception of 8 years of sobriety when my kids were young. October 23rd, 2020, I had a seizure with vomiting in my living room floor at about 12:20 a.m. I had tried not to drink that morning because the shame was so unbearable as the thoughts of the events from the previous day flooded my brain. It had been my youngest son's 15th birthday, and all my kids were over with my 6-month-old grandson, who I was holding, feeding, and changing his diaper. And I was into my 2nd gallon of vodka, and of course, no one knew. I called the union's treatment line minutes after making my way to my vodka to stop my DTs. I was helped through the process by a team of 3 wonderfully kind and empathetic women that lived in Minnesota. There wasn't a day that went by that I didn't hate myself because I was totally controlled by alcohol. I drove drunk every day. Combining years, I could count on one hand how many sober days I had had. Your 12-month program literally saved my life. The Betty Ford Foundation in Palm Springs is a beautiful place. Every day is designed with a structured routine, most of it being extremely informational and crucial to my recovery. Now the aftercare. My counselor is next level. In my opinion, he has truly mastered his craft. When I left the safety of the Betty Ford compound, it was scary. With prior years of contemplation, I had known once I pulled the trigger on rehab, I would never drink again. But that meant my entire life as I knew it was going to be different, and that was terrifying. So to use some of his words, what does that look like for you? What was my life going to look like walking around a grocery store without a drink in my purse? Pumping gas sober? What was my life going to look like sitting at my son's games without vodka in my water bottle? Coping without alcohol? Scary. Every moment, every day new. Some very challenging, full of anxiety, doubt, fear, many feelings that I didn't even understand. Thank God for my counselor. He was always quick with a response and available to take me off the proverbial ledge at a moment's notice. Always with very grounding words to help me put things in perspective so my mind could relax. Without guilt or judgment, unbiased words of encouragement. He helped me to make space for how I was feeling and then move on. He figuratively held my hand every step of the way. I would have been lost without him for that 11 months. This is priceless to me. And the best way I can show respect and appreciation is to pass it on by trying to help others struggling with addiction. I don't know what my recovery would have looked like or exist if it wasn't for this program and this counselor. But I can tell you what my life looks like at 15 months sober. I'm in my second semester of college. My focus in social work. I am in EMDR therapy for PTSD from childhood trauma. I'm working for senior helpers. It doesn't make ends meet, but I'm helping people that need it. And in 9 months, when I am 2 years sober, I can start applying for a job as a peer recovery mentor. Thank you for taking your time to read my story. I truly wish I could hug each person and individually thank anyone that had a hand in creating this program from the bottom of my heart. Thank you for this program that gave me this chance at a happy and healthy life. This is a debt that can never be repaid, but I will keep trying to help others that are still suffering. So we wanted to put some resources up for you all as well, from not just from the Hazelden Betty Ford, but also just some general resources from SAMHSA and NIDA, et cetera. The Center of Excellence is something that, as you can see or hear from my reading the letters, that affects individual people. It's something that is very powerful to work with payers and employers and EAP that are truly looking out for their members and wanting to see their employees and members truly get better and get on that path to recovery. So I want to say thank you and be well. And we truly appreciate everybody who joined the call today. And I'll turn it back over to our moderator.
I'd like to just remind everyone that the slides and recording will be posted by tomorrow. Thank you everyone in the audience for joining us for today's web forum. And yes, the slides and recording will be posted by tomorrow on the Open Minds website. The Full Circle Elite Executive Roundtable series is also available on demand as part of the extensive Open Minds library, and is also available from the Open Minds YouTube channel as well. Please join us for our next roundtable, which will be on Thursday, January 12th at 1 p.m. Eastern Time. The topic will be fostering innovation and entrepreneurship with managed care organizations, the VOA and Humana case study. During this live 1-hour presentation, Stephen Samuels, Vice President of Innovations and Impact Investing for Volunteers of America, and Abby Gilbert, Associate Director of the Office of Health Affairs and Advocacy with Humana, will discuss how VOA is expanding services and cultivating deal flow for its impact investing subsidiaries, the Futures Fund. Attendees will learn how VOA and Humana Foundation are planning for their second cohort in early 2023, which will double the program size to 6 organizations. For a full list of upcoming roundtables or to register for the January 12th event, please visit the Executive Roundtables page under the Events tab at openminds.com. Thank you all.